Gentlemen, let's talk about something private, natural, and often misunderstood. Self-pleasure. You've probably heard all the myths that it's harmful, shameful, or something you should have outgrown. Let me be clear right from the start. Masturbation is a completely normal, healthy part of human sexuality. But here's the question I get asked constantly in my practice. Can you do it wrong? Can your technique actually interfere with your intimate life with a partner? The answer might surprise you. I'm Dr. Narita, a urologist with 12 years of experience. And today, we're going to have an honest conversation about 3 ways that certain masturbation habits can unintentionally affect your sexual function, and more importantly, what you can do to fix it. Stay with me because understanding this could be the key to a more satisfying intimate life, both solo and with a partner. Before we dive into potential problems, let's establish the truth. I'm completely prom. It's the ultimate form of self-care and self-pleasure. It reduces stress, improves sleep, supports prostate health, and helps you stay connected to your own body. There's no right number of times per week or month. If you're maintaining your relationships, fulfilling your responsibilities, and enjoying your life, then your habits are perfectly fine. However, and this is important, just like any physical activity, technique matters. If you've developed habits that your body has become overly accustomed to, it can create challenges when you transition to partnered intimacy. This isn't about shame or failure, it's simply about understanding how your nervous system adapts to repeated patterns. Let me explain the science briefly. Your nervous system is incredibly adaptive. When you repeatedly experience pleasure in a very specific way, whether it's a particular grip, position, speed, or even mental fantasy, your brain and body start to expect that exact pattern to reach climax. This process is called habituation. Think of it like training for a sport. If you only ever practice shooting a basketball from one specific spot on the court, you'll become excellent at that one shot, but you might struggle when the game requires you to shoot from anywhere else. The same principle applies here. If your body becomes deeply conditioned to one very specific method of stimulation, it can become more difficult to respond to the different sensations that partnered intimacy provides. Now, before we count down the 3 specific techniques that can cause problems, quick pause. If you're finding this valuable, hit that like button and subscribe to the channel. Drop a comment below. Where are you watching from? I love connecting with men worldwide who are serious about their health. Let's break down the 3 most common technique-related issues I see in practice. Problem number 1, prone masturbation. What it is? This is when a man masturbates lying face down, typically thrusting against a mattress, pillow, or other firm surface rather than using his hand. The biology. This technique was first described medically in 1998 and called traumatic masturbation syndrome. The concern is that the pressure, angle, and sensation are dramatically different from what occurs during partnered intimacy. When this becomes your primary method over months or years, your body's arousal pathways become specifically tuned to that unusual pattern of stimulation. The practical problem. Men who develop this habit often report difficulty achieving climax with a partner, less firm erections during partnered sex, or even reduced sexual desire because their body doesn't respond the same way to more typical stimulation. The emotional impact. Imagine finally being intimate with someone you care about only to find that your body won't respond the way you expect. It's frustrating, embarrassing, and can create serious anxiety about future encounters. Problem number 2, the death grip syndrome. What it is, this isn't an official medical term, but it's widely understood to mean using an extremely firm, tight grip during masturbation, much tighter than any mouth, hand, or vagina could naturally provide. The biology. When you consistently use very intense pressure or friction, the nerve endings in the penis gradually require more and more stimulation to trigger the same pleasure response. This is habituation. Again, over time, you need an even firmer grip to reach climax, which creates a vicious cycle. Eventually, the more gentle sensations of partnered intimacy simply don't provide enough stimulation. The practical problem. During partnered intimacy, you might find it takes much longer to climax, or you can't climax at all. Your partner might feel inadequate or rejected, even though the issue is purely mechanical. The emotional impact. This creates performance anxiety, relationship strain, and a sense of being broken. Many men start avoiding intimacy altogether because they fear disappointing their partner. The medical reality. In one study of 500 men experiencing delayed ejaculation, 37% reported using what researchers called idiosyncratic masturbation methods, techniques that simply can't be replicated during partnered sex. This includes not just grip strength, but also specific speeds, positions, or even mental fantasies that become inseparable from arousal. Problem number 3, aggressive techniques and physical injury. What it is? This involves any technique that includes forceful bending, twisting, or applying pressure to the penis in ways that stress the tissue, particularly when the penis isn't fully erect. The biology. The penis contains erectile chambers surrounded by a tough, fibrous lining. When you bend or twist an erect penis forcefully, you risk tearing that lining, a condition called penile fracture. Yes, it's a real medical emergency. You might hear a pop followed by immediate swelling, bruising, and severe pain, the long-term risk. Even if you don't have a full fracture, repeated micro-injuries from aggressive techniques can cause scar tissue plaques to form, which can lead to curvature of the penis or erectile dysfunction over time. The practical problem. This isn't just about pain in the moment. It can lead to permanent structural changes that affect function for the rest of your life. If you recognize yourself in any of these descriptions, don't panic. Your body is adaptable, which means it can relearn. Here's your action plan. Step 1, take a break. Give yourself at least 2 to 3 weeks away from masturbation entirely. I know that sounds difficult, but this reset period allows your nervous system to return to baseline sensitivity. Step 2, change your technique. When you resume, commit to doing things differently. Use plenty of lubricant to reduce friction and train your body to respond to gentler stimulation. Vary your grip. Use a lighter touch than you're accustomed to. Change positions. If you've always done it one way, try another. Slow down your pace. Avoid relying on very specific or extreme fantasies. Try using your imagination in more general, flexible ways. Step 3, rule out medical causes. Before assuming it's purely technique-related, see your doctor to rule out low testosterone, side effects from medications, especially antidepressants, diabetes or nerve damage, circulation problems. These medical issues can all reduce sensation and need proper treatment. Step 4, consider professional support. If you're struggling to change habits on your own, or if this is affecting your relationship, consider seeing a sexual health therapist. They can guide you through techniques like sensate focus, a method that helps retrain your brain to respond to your partner's touch by removing performance pressure and focusing purely on sensation and connection. Everyone wants a specific number, but there isn't one. The real measure isn't frequency, it's impact. Ask yourself honestly, is it interfering with my work, relationships, or responsibilities? Am I choosing it over spending time with people I care about? Is it taking up hours of my day that I'd rather spend on something else? Am I unable to function sexually with a partner because of my technique? If you answered yes to any of these, it's time to reassess. Not out of shame, but out of a desire for a fuller, more balanced life. If your habits aren't causing any problems, if you're still able to enjoy partnered intimacy, and if it's not consuming your time or thoughts, then you're absolutely fine. Continue as you are. If you're dealing with any of these issues, I want you to hear this clearly. You are not broken. You haven't ruined yourself. Your body has simply learned a very specific pattern, and patterns can be unlearned. Sexual function is complex. It involves nerves, blood flow, hormones, psychology, and learned behavior. When something isn't working the way you'd like, it doesn't mean you failed as a man. It means there's a specific solvable problem that needs attention. Many men carry deep shame about these issues, which only makes the problem worse. Shame increases stress. Stress reduces sexual function, and the cycle continues. Breaking that cycle starts with self-compassion and honest communication with yourself, with your doctor, and if you're in a relationship, with your partner. Bottom line, gentlemen, self-pleasure is healthy, normal, and beneficial. But like anything involving your body, technique matters. If you've developed habits that are interfering with your ability to enjoy intimacy with a partner, the good news is that your body can adapt and relearn. It requires patience, intentional change, and sometimes professional guidance, but it is absolutely achievable. Your sexual health is an important part of your overall well-being and quality of life. Don't let embarrassment or shame keep you from addressing issues that are affecting your happiness and your relationships. If you found this helpful, please share it with someone who might benefit. Leave a like to help this message reach more men and subscribe to the channel with notifications on for more honest, evidence-based content on men's health. Remember, your vitality, your pleasure, and your connection with others don't have expiration dates. With the right knowledge and approach, you can maintain a fulfilling, intimate life for decades to come. Take care of yourself because you are absolutely worth it. I'm Dr. Narita, and I'll see you in the next